Hi. Overactive bladder is quite a complex condition. In some cases, even medications may not help. So, what then do we do? And that is a case called refractory overactive bladder, where you've tried behavioral therapy, you've tried medications, and you still have that gotta go problem. So, now what do we do? So this is a condition where behavioral therapies such as dietary modifications, time voiding, pelvic floor exercises have not worked, medication has not worked, and is all lost. No, there are a lot of still many options left. The most important thing, however, is to make sure that we understand that the diagnosis is correct. Are we truly dealing with urgency leakage, gotta go problem, or is it something else? So the first thing is that before we go into advanced therapies, which is down here, re-evaluation is very important. So we have you again fill out some of these questionnaires. As you can see in this patient, make sure that this is not urgent stress incontinence, but still urge incontinence. For example, as you can see, she is still very bothered by urgency complaints, not really as much bothered by stress incontinence. So from the questionnaire, it seems to be correct. Examination may be necessary to make sure that nothing has changed. Voiding diaries are also important because this will help us understand the number of times do you leak in a day and number of times that you have leakage or urgency episodes over a 3-day diary. Sometimes I may also repeat the urodynamic testing, especially if the past urodynamic testing showed a combination of both stress incontinence and urgency incontinence. It is very important to determine what is the main complaint that you have and how well does that correlate with our findings. Also important is to make sure that your urine analysis is fine and there is no infection and you are not retaining fluid. And this is important because if you are retaining urine in the bladder, that could be because of a medication and that may be in fact worsening your urgency leakage rather than helping. Then we come to the management. So we've gone through the different parts. We've done our initial evaluation, done the lifestyle modifications, did not work, put you on a medication, reevaluated you, and now let us talk about the advanced therapies, which are several. So what we'll talk about next is leg stimulation. Really? A leg stimulation helps my bladder near the ankle? A toxin in my bladder? Are you sure, Dr. Kandwala? And a battery in my butt? You must be kidding me. Well, nope, I'm not. These are three very viable options, and I will show you not only what it is, how does it work, but also what is the literature on it. So let's talk about that soon.